Welcome to Chiropractic Science, where you get to hear interviews with leading chiropractic researchers from around the world. Hear about chiropractic research from the authors in plain English, not through the media nor a middleman. My name is Dr. Dean Smith, and I am the host of Chiropractic Science. I'm an associate clinical professor in the Department of Kinesiology and Health at Miami University, and I'm also a chiropractor in Eaton, Ohio. My research interests relate to understanding how chiropractic affects motor control and human performance. Today, I have the privilege of interviewing Dr. John Mayer. But before we get to the interview, I wanted to thank all of you who have subscribed to Chiropractic Science, and I'm especially appreciative to all of you who have contributed 5-star reviews on iTunes. iTunes helps others find out about chiropractic science. So if you like the show, please take a second and write a review. It will support chiropractors everywhere. I'd like to share a review on iTunes from someone with the nickname MyDebS, who says, Dr. Dean Smith has an effective interview style that is easy to listen to. He presents a variety of evidence-based relevant topics. Thanks for keeping the profession and public updated. Well, thank you, MyDebS, for your review. I look forward to sharing your flattering iTunes review in a future podcast. Please consider making a contribution to chiropractic science to keep these podcasts going. You can do so on our website either by making a donation or by purchasing the evidence-based patient education slides presentation. We're also on social media, including Facebook and Instagram, so please connect with us there. All right, on to the podcast. Well, let's get on to the interview with Dr. John Mayer. Dr. John Mayer is the Lincoln Endowed Chair in Biomechanical and Chiropractic Research, Executive Director of the Center for Neuromusculoskeletal Research, and Professor of the School of Physical Therapy and Rehabilitation Sciences, Morsani College of Medicine, University of South Florida. He is Director of Research and Innovation for U.S. Spine and Sport Foundation, Chief Scientific Officer of Excellcior, LLC, and co-founder of Pillar of Health, LLC. Dr. Mayer obtained a Doctor of Chiropractic degree from the National College of Chiropractic, now known as National University of Health Sciences, and a PhD degree in Exercise Science and Science Education from Syracuse University. He is a licensed chiropractic physician in the state of Florida, a fellow of the American College of Sports Medicine, and a certified clinical research professional from the Society of Clinical Research Associates. He has extensive clinical and research experience in occupational health, wellness, and therapeutic exercise. Dr. Mayer has led teams on numerous clinical trials across the country on various aspects of wellness, clinical management, and prevention funded through federal, state, industry, and foundation sources, including the largest single financial commitment by the U.S. Department of Homeland Security on low back injury prevention in firefighters. He serves on the Scientific Secretariat for the Global Spine Care Initiative and Clinical and the Scientific Advisory Board for World Spine Care. Dr. Mayer received the 2012 Safety Award from Tampa Fire Rescue, 2014 Researcher of the Year Award from the American Chiropractic Association, and the 2015 Outstanding Research Achievement Award by USF. Dr. Mayer, it's a privilege to have you on the Chiropractic Science podcast.
Thank you, Dr. Smith. I appreciate the opportunity.
Absolutely. Well, let's get started. Can you tell us how you became interested in becoming a chiropractor?
Yeah, that's a great question. After I graduated from undergraduate degree in upstate New York, I was choosing two pathways, but both were closely aligned. I had interest all along in health and wellness and fitness, and at that juncture, the decision was to go to graduate school in exercise science, health, public health, or some healthcare provider type of career. And at the time, I thought the perfect mix was chiropractic because I could have direct impact on people in a clinical setting versus going on to get a PhD at that time. What that would mean is not the ability to impact people directly with a licensed healthcare degree. So thus I chose chiropractic, and subsequently the PhD reappeared again in my life, but that's the original reason why I became a chiropractor. I really wanted to focus, and I thought it was the best profession that I could possibly be involved with to impact people's lives from a wellness standpoint. And to this day, that's the focus of my efforts.
Oh, I love that. I love that focus. So have you practiced as a chiropractor then?
Yeah, so I graduated from National in 1991, practiced exclusively for 5 years as a private practitioner, worked as a associate for a highly regarded chiropractor for a year and a half, and then I had my own practice for 5 years or 6 years full-time. First opened up in a wellness and fitness center, and a very interesting experience. It gave me the opportunity to practice a more broad scope chiropractic practice within the musculoskeletal realm, but more aligned with fitness and such. And then I continued to practice part-time throughout my PhD, getting my PhD degree. And then I moved to San Diego and practiced there clinically part-time in an interprofessional setting. I currently have not practiced in a traditional manner in some time. I do consulting work as a chiropractor and do examinations, evaluations to some extent. And I miss it, and thus when we were able to talk about it a bit more, the transition of my career at this point. So I'm anxious to re-engage hands-on as patients. With that said, some of the research we've done is highly aligned to chiropractic, and that is done within my scope of practice as a chiropractor. So at least indirectly, I'm practicing.
Yeah, perfect. So what was it that got you interested in the PhD? Like, I know you said as an undergrad you were kind of undecided, but when you got done and you were practicing for a while, what was it that made you say, hey, let's go back and get that PhD?
Well, first of all, I always like to keep moving. Yeah, the pun is intended as far as moving, as far as fitness and physical activity, but also moving forward with innovations in career and the ability to help people and impacting lives. I figured I could do more with a PhD than as a practitioner and chiropractor with a DC degree alone. And as a mentor that I had very close, not at the time I made this decision, but subsequent there, Vert Mooney, MD, who's an orthopedic surgeon and the founder of U.S. Spine and Sport Foundation that I now direct the research and innovation program for. His biography is entitled The Unguarded Moment. And this case, why I went back to get a PhD exactly at that time, was an unguarded moment for me. I wasn't really expecting it. It was always in my mind, yeah, I'm going to go back and get my PhD. But the unguarded moment was that the new chair at Syracuse University in exercise science, Jay Graves, I knew of him through his work in lumbar strengthening exercise and developing innovative protocols, progressive resistance exercise protocols at University of Florida. I learned that he moved to Syracuse. I'm like, oh, how about I go talk to Dr. Graves? Went him, met him at Syracuse, and I remember the day, some snow, of course, but it was a serendipity or unguarded moment that why I got at Syracuse at that time. And I from Rochester, New York to Syracuse, New York is 90 miles, and for the first year and a half or so of that program, I was commuting back and forth, and I just needed to focus on one thing at a time, so I ultimately moved to Syracuse to do my research and dissertation work, and left practice full-time for a few years. So that was it.
Gotcha. Well, that is so cool. I know a lot of chiropractors are going to want to know about your current position at the University of South Florida, as well as your other affiliations. Can you tell us about those experiences?
Yeah. So how I got to be at University of South Florida, I'll start there, and I'll work my way about what we've done here and then moving forward. So I was involved with U.S. Spine and Sport Foundation since 2000. I was in San Diego. I started working with Dr. Scott Haldeman, who the audience will know, and I believe, Dr. Smith, you've done a podcast on him. He needs no introduction. I was working with him in Southern California on his World Health Organization Joint Decade Neck Pain Task Force as a research associate. And another one of those moments in my life where he was being consulted with about who are we going to get for this endowed chair. He was working with the University of South Florida. They were calling him to get his expert opinion on who. A little bit difficult time. The history regarding this position was interesting. It's the first ever endowed chair position held by a chiropractor in a college of medicine in the U.S. Anyway, I was at Scott's office, and he's like, I have this call with some dean at the University of South Florida, and he's like, hey, well, you might be a good fit there. And so that's how I ended up here. The position, it's like I said, it's the first ever endowed chair position, research endowed chair position held by a chiropractor in the U.S. So with that has come, one, I'm grateful and honored for that opportunity or this opportunity, but it's also I'm carrying the load, the responsibility of the profession. So the experience has been great. We've had our challenges fitting into the system, but I can say this with all sincerity. When you come in with an interprofessional mindset, you put your guard down, pull the walls down, start talking research and evidence-based practice. The initials after your name don't really matter. So we have collaborated well with our medical colleagues and physical therapy colleagues here. We have had $10 million of external funding from grants, contracts, state funding. We started the first ever state commitment for a Center of Neuromusculoskeletal Research, which is doing well now. But it's had its challenges. I'm the only chiropractor here now, at least in the research setting. And but the experience has opened doors for myself, but I think more importantly for the profession that weren't otherwise open. So as I transition away from this appointment, I've been here for 10 and a half years. The donors, the Lincoln College Education and Research Fund and the other donor, the Florida Chiropractic Association, what we set out to accomplish, we have reached a lot of those goals, and it's time to transition me personally to new challenges for myself, but to help the profession, to help people, and my desire to get back into clinical work and do some more research and development type activities. The experiences of the chiropractic endowed chair has been good. It's been challenging sometimes, despite, strip off the initials. It's great experience. We talk research, evidence-based practice. Sometimes it's like an island here. So depending on the donor's wishes and as they move forward, I hope to be involved with grooming or possibly serving as a mentor, the second appointee to the endowed chair. So moving forward, going back to where I started several years ago after my PhD, directing research and innovation for a nonprofit research foundation that was founded by Bert Mooney, as I mentioned earlier. We have some big plans to continue on the research that we've done with first responders, engage in more developmental activities, and the clinical work that I'm going to do will be housed with a company that I started with a colleague, Charity Lane, who's been integral in the development of the programs that we've had. So we have the research component coming out of the foundation, and then some of the private clinical work and research and development for first responders and military and other high-risk workers coming out of the other company called Excellcior. So that's the plan, and doing this, one, I think the opportunity to stronger enforcement of chiropractic on a level that I think is needed, and to have an expanded impact on helping people, particularly in the wellness area that I think chiropractors can have a large impact, much larger than we have right now.
Amen. I love that. Thanks for sharing all of that amazing information. You've been published in a wide variety of excellent journals, including Spine, the American Journal of Health Promotion, Spine Journal, Archives of Physical Medicine and Rehabilitation, and lots of others. I know one of the topics you wanted to cover today that you just mentioned is how chiropractors are well equipped to be leaders in holistic care, particularly for first responders, and we'll get back to that. But first, I wanted to talk about some of the articles of yours that will give listeners an idea about your research. And one theme that you've had over the years has been on low back extensor strengthening. So I think a great article to talk about was one in the Spine Journal in 2008. And this was evidence-informed management of chronic low back pain with lumbar extensor strengthening exercises. And I know that whenever I have a question personally about lumbar strength training, I always look to your research because I know of your expertise in the area. So could you guide us through this paper and your interest in low back extensor training and what you found?
Sure. So, first of all, I just realized the date of this article, and it was 10 years ago. However, the information is still very relevant today. A little bit of history on this particular aspect. My doctoral dissertation was on progressive resistance exercise, developing it and testing progressive resistance exercises for the back, particularly eyeing treatment of chronic back pain. I looked at 2 or 3 different strategies on how well activation and activity patterns were, the specific of lumbar muscles, the rectus spinae, multifidus, and quadratus lumborum in particular, using T2-weighted MRI. And we looked at different types of lifts under different intensities, as well as looking at some occupational lifts, a stoop, asymmetric stoop, and squat. So that's where it started. And I continued on that work, and I moved out to San Diego in the first place to work on an NIH grant that developed a progressive resistance exercise for the back. So one thing that I observed over the years, and my background is in fitness and such, that the back pain spine care community has highly aligned, or had highly aligned at the time, on low-level, low-load core stability exercises. And I understand the concept and the purported mechanisms, and I have good things to say about those. And in our firefighter work, we incorporate strengthening exercise with core stability, or now the flavor to call them is motor control. I have a little bit of historical perspective on why that wording has changed. But anyway, strengthening exercise. This particular article is a systematic review. It was a component or a chapter article in Dr. Haldeman and Dr. Dagenet's special issue of the Spine Journal on evidence for management of chronic low back pain. And this was one of the topics. And there was also another author that did motor control exercises, the various interventions and diagnostic techniques for spine care. Anyway, so what this article, this systematic review, found is that, yes, strengthening exercises were beneficial for back pain, chronic back pain in this case. One of the concerns people have is that you shouldn't be doing strength training of any type for the back. Your back should be guarded. You should be doing isometric work, low load, motor control. Well, your back's not actually designed to only do that. It's designed to do strengthening exercises just like other muscle groups. So my concept or model, and supported by some colleagues, that train the back like you train the rest of the body. And yes, I understand the nuances with the back and the motor units and the different patterns that the back might have, and maybe treating the back exactly like other muscle groups isn't always accurate. However, this concept was popular in the early 80s. Tom Meyer, Bob Gatchell, and Vert Mooney started strength training for back and functional restoration, and then it faded away for no apparent reason. But anyway, this systematic review, back strengthening exercises beneficial. The effect sizes were modest. The effect sizes attenuated or weakened over time, and we couldn't find any evidence that back exercises were superior to other forms of exercises. That's essentially the finding. But an important finding. We found no evidence to suggest that strengthening exercises results in any more higher rates of adverse events than the lower load exercises. Within that comparison, the lumbar extensor strengthening exercises were no different than other exercises, that you could look at that the other way too, that we found no evidence, and this is still clear today, and actually there's a systematic review on motor control exercises, Cochrane review. They're beneficial for chronic low back pain, but they're no better than any other exercises. So, since 2008, the data in that regard hasn't changed, but the mindset has changed a little bit, at least from some of the people, the thought leaders in the field. There are a number of ways to do strengthening exercises for the back. Isolated strengthening exercises under resistance is one, which is specialized equipment. You can also do strengthening exercises, depending on your physical fitness level at baseline, floor exercises, off of a bench, off of a Roman chair, free weights, deadlifts, traditional deadlift or Romanian deadlifts, whatever your preference is. Those type of exercises, and particularly the deadlift, there's 2-3 articles that show that they can be beneficial for chronic low back pain, and offered some guidance on when to incorporate those type of free weight exercises for chronic low back pain. Of course, you're not going to do them in the more acute stages, but these type of developments over the past 10 years are of interest to me, as our group, both from a research perspective and clinical perspective, but program implementation perspective for first responders and military. We need to have variety for the patients. With any exercise program, whether it's for back or general conditioning or cardiovascular, whatever it might be, the number one factor to get results is adherence. In the absence of any difference clinically, one thing we need to look at is patient preference, which has largely been ignored across multiple healthcare domains, but particularly exercise. So we need to give people options, one, for the resources they might have available for strengthening, but two, what's the preference? I see no evidence to push somebody into doing isolated exercise on a machine if they want to do deadlifts or want to do some exercises, progressive exercises off of a bench. And likewise, if they want to do core exercises on the floor with the bird dog or the cat camel or whatever the flavor is, go ahead. But for strengthening, this paper laid the framework for what has occurred over the past 10 years.
Wow, I love it. And I really like all of the examples you gave and the idea that patient preference should weigh in heavily, and that you answered a lot of my questions actually about what types of exercise you would recommend and whatnot. So that's great. And, the other thing is that this is a timely topic, especially given that the Lancet series on back pain just came out in March, and I had Alice Kongstead on the last podcast. She was talking about the Lancet Working Group panel, and the recommendations as first line of treatment are to remain active and exercise, especially for chronic back pain. So I think you answered most of my questions in terms of recommendations. Do you have any resources that you might recommend to chiropractors in practice, how to begin an exercise program or a strength training program for the back at all?
Well, the systematic review that we just talked about would be a good starting point, and there's a series of references within there. But you bring up a good point that I can't answer that pragmatic or implementation question. I can cite off the research because it's not there. So one of the things that our group is going to do is put together exercise training manuals for this particular purpose, considering resources, Resources, patient preference, mode of delivery, whether it's supervised or web-based, and other factors regarding the environment. Is this going to be home-based? Is it going to be at a job? Is it going to be on a shift? Is it going to be, for military when they're in combat? So we are working on that because there's not a lot of guidance on there that is evidence-based.
Yeah, that's perfect.
Some of the thing about when, first of all, the Lancet work that just came out is great. When do work in strengthening exercise? Well, not early on. With acute back pain, probably not. So a lot of people do recommend that, and some people recommend other types of exercises, but let's focus on chronic back pain. For progressive resistance exercise, in other words, strengthening exercise, the progression should be slow and gradual. You need to start patients at a much lower level. And one thing that I've learned, and we numerous times, is that people in general are afraid to move when they have back pain. They're particularly, when you mention strengthening or anything with weights, a lot of people are going to be apprehensive about that. I used to inform patients or research participants, I used to state, you might get sore. Now I just say you're probably going to get sore. When you're working on muscle groups that have not been trained before, you're very likely going to get sore, regardless of your previous experience with the exercise. So start very gradual, very, very gradual. I try to follow the new ACSM guidelines as far as gradual progression. They just came out with a new guideline in 2018 that's very helpful that I would suggest chiropractors. You mentioned about resources. This is one. Start with the ACSM guidelines on exercise prescription, and most chiropractors and most physical therapists don't, to my knowledge. Start there. If you want to be grounded in the evidence for general exercise prescription, I think that's a great place to start, whether it's for strengthening exercise, cardiovascular exercise, motor control exercise, flexibility. This is where the evidence lies. And to work with other practitioners, particularly those in the fitness community. We need to start talking. We as a chiropractic profession like people to be able to talk our language, but we need to talk their language too. So they often the fitness experts, they don't. If we want to collaborate with them in some regards, and when I'm going to talk about wellness possibilities for chiropractic physicians, we need to collaborate with them. They're extremely helpful and talented. We need to talk their language. They're grounded in the ACSM principles and some of the NSA standards. We should be better versed in that, in my opinion. And it probably should be taught at the chiropractic schools in more detail.
Yeah, that's excellent advice. ACSM, I use their guidelines regularly. Of course, teaching in a kinesiology department, very familiar with that. And the other thing the clinical pearl that I really liked that you gave was about people they should expect some soreness. That's usually what I say, even after chiropractic treatment, especially if it's their first time ever getting adjusted or doing any kind of particular exercise. You should expect a little bit of soreness. If not, that's okay. That's great. But you're probably going to have some. So terrific. Now, I'd like to talk about your research with first responders, particularly firefighters. And then you've also done some work with military. So one of the papers that you published here recently was on the use of participant focus groups to identify barriers and facilitators to worksite exercise therapy adherence. And this was with firefighters. Can you tell us about this paper?
Yeah, so this particular paper was conducted, the data were collected after the randomized controlled trial was completed. So the conclusions from this paper need to rely on the conclusions of the main findings of the RCT. So I'll briefly describe what we found in the randomized controlled trial and then what this paper did in particular to help us plan into the future, not only for further research, but as far as implementation efforts was absolutely critical, and it led to the findings of the current study. So this particular study was a study funded by FEMA. We've been fortunate to get repeated FEMA funding for our research efforts starting back in San Diego. This is the second in line of 3 that we've had so far. Cluster randomized controlled trial at Tampa Fire Rescue. We enrolled 106 firefighters, and it was a proof of concept study, if you will, to look at the effect of on-site exercise for the back and core while the firefighters were on shift compared to control. So some of the firefighters, based on their station, were assigned to exercise under supervision. Others were just control, natural history. The several things we looked at. One, can we actually do this? I mean, these are firefighters that are on duty. They're busy. They're getting busier. They don't have the time in many cases. And some people say, well, they work 24 hours on, 48 off in a lot of cases. Sometimes they work 48 on, 96 off, and there's all sorts of iterations. Nevertheless, they're shift workers, usually 24-hour shifts minimum. Oh, you can fit in exercise. Well, no, they can't. They don't sleep good. They have numerous concerns to manage. They're fighting fires, but more importantly, or taking up more of their time, at least now, is they respond to a lot of medical emergencies. So a lot of their responses now are medical. So in many cases, they're acting as almost like a primary provider for the community, and I don't know if many people realize that. Over the past 6-7 years, the number of fire-related responses has not increased, or it has increased slightly. The number of emergency or medical responses has increased dramatically, with an overall increase in number of calls in our particular area of 21%. At the same time, only about 2% more firefighters are employed. So they're much busier. So the goal of this study was, can we implement a standardized back and core exercise while firefighters are on duty? And 1, is it safe? 2, does it not disrupt operational flow? And 3, do you get the physiological gains that you would expect, meaning improvements in back muscular endurance as measured by Barrett-Sorensen test, and also prone plank test, both isometric endurance tests. Yes, we found that it did. The results for both the prone plank and Barrett-Sorensen tests were clinically meaningful and statistically significantly greater than the control. No, it didn't disrupt operational flow of the fire service. Firefighters were able to work this in. Our overall adherence rate was about 67% of the exercise sessions were completed. That was about what we hypothesized. That seems low, but in this particular population, it was good, and it was safe. Saw the typical delayed onset muscle soreness, but all cases were self-limiting, and nobody had any circumstances that were considered serious adverse events. So overall, it accomplished what we want in terms of the clinical aspect. Now, this particular paper, looking at barriers of facilitators of worksite exercise. Findings. Really, the framework was, what are we going to do? Okay, we're pretty clear that you can strengthen the back, make it more, improve the motor control, improve the stability. Now, what is the best way to implement this in the next research study or as a program? Found some very interesting findings with this, and it goes to, 1, in chiropractors and practice, you need to keep this in mind when you're implementing an exercise program, which majority of chiropractors do, whether supervising a clinic or home exercise program. But this provides guidance in that regard overall, particularly for this group. Firefighters need time to exercise. This doesn't sound like, wow, that's an extravagant finding. They need time to exercise. They identified time to exercise as a problem. They need to have support from their peers and their managers or the chiefs. How their management and chief flows and their peer flows, they go to. So they all move together. If the chief is not active, the captain's not active. It's not only the positive peer pressure, but they get the negative peer pressure dramatically. And that goes not only with exercise, but also nutrition. So if your chief's not on board, if your captain on that shift isn't on board, the shift commander is not on board, it's a huge negative to exercise. And also, the firefighters are competitive. They like some sort of friendly competition, and they like to be incentivized. Those are the key factors. How do you incentivize a firefighter, or if you're doing any worksite wellness program, how do you do that? Financial incentives were discussed, but it doesn't even have to be financial incentives. They just want something that's meaningful, whether it's, it sounds a bit mundane, but it's, it came up numerous times in these focus groups we've had. Even shirts to different levels. They did this, they achieved this level in the exercise or whatever it might be. So they also, a few other things, they liked supervision, but they didn't think it was necessary each time. So we're developing, we've tested new approaches, a hybrid approach with some supervision, but using a web-based exercise app that tracks and guides and provides support remotely. So something in that regard would be useful. And they also liked variety. So our particular program is very strict, and we did 5 exercises, one a back strengthening exercise, and then 4 core stability. They preferred some variety. So that was what we found, and in a subsequent study that we just finished now, we tested some of those implementation factors, and the data are being analyzed now, but it supported what we found in the previous study, and also provided more evidence to suggest that a hybrid approach where some supervision combined with electronic app or guidance was probably the best method overall, one for adherence and 2 to maintain cost. So that's what we found in those studies.
Yeah, perfect. Those again, some great takeaway points for the practitioner. I like the idea of giving some supervision, but not, being like a hawk over the exercises. And then using the app, that's really interesting too. It's not something I'd thought about, but that's the way it's going for sure. And people like that. So why not? It's perfect. Great. Well, let's talk about some of the implementation. And you had mentioned the one with the firefighters, the worksite exercise program. But I also wanted to talk about the study that you've done with the military. So can you tell us about the implementation studies that you've been involved in here?
Yes. So we completed the 3rd research study for the first responder and firefighter work, the FEMA-funded studies. And we're now working on implementation under the realm of called the First Responder Wellness Initiative. And starting here in the state of Florida and moving across country, at least the second site or current site will be in Southern California. In addition to what we found about strengthening exercise and core stability exercise and implementation factors around exercise, working with this group, we realized that you just can't focus on physical activity. Wellness is a package that comes as a package. There's other things that matter, and everything's interlinked. For example, in my opinion, and working with this particular population, you can't dissociate the nutrition from exercise. You can't dissociate behavioral health from the exercise. You can't dissociate some of the other medical conditions and the exposures that these people get from the exercise. They all come together as a package. If you choose to align or focus on one of these areas, then I think it's, one, as a chiropractor, you're not giving the benefit that you can, and you might be doing a disservice to this group. So in addition to firefighters' problems with, back injuries, they have sleep disorders, their nutrition is horrible, the rates of obesity are high, which might surprise some people, but in our previous study, or our work and other groups' work, 80 to 85% of firefighters are overweight or obese, measured by various methods. So, obesity in firefighters is related to higher rates of injuries and disabilities, etc. So, one of the first things that I will do with the team and our First Responder Wellness Initiative is address this overall wellness. And I know wellness is a mixed bag, and it has, it sounds great. You Google wellness, you get all sorts of different things you wouldn't imagine. But anyway, in this context, particularly for chiropractors, we should lead the field in first responder wellness. Everything that I mentioned, a chiropractor can be involved with, coordinate, manage, supervise, lead, however you want to describe it. And I don't think any other provider can do it better than us. And I'm pretty sure nobody can. So within the wellness model for first responders, implementation in our initiatives, we're hitting on the pillars: health, behavioral health, sleep, nutrition, exercise, form the foundation. So can't just apply the intervention. You need to do the testing up front to help guide the individualized approach for the first responders. So we're on those implementation efforts are underway now. We have a working relationship with the department in St. Petersburg, Florida, that we will start this program, and like I said before, we're moving it across country. So from the wellness aspect in general for first responders, I alluded to already, there's various facets. There's no one provider that can oversee these services better than a chiropractor. However, there's no current structure to it. First responders, in our research, many of them go to the chiropractor for the back pain. That's all they think: chiropractor, back pain, chiropractor adjustment, and that's great. That's great. I'm glad they're going to a chiropractor to help their back pain, and that's the work that I've done. However, the services from an entire wellness scope for chiropractors is just profound what we have to offer this group. I'm excited about moving this forward, and if we just published a paper in the Florida Chiropractic Association Journal on this topic, chiropractic physicians as leaders in first responder wellness. So that's the starting point, and we're developing methods right now, courses, sequences for firefighter or for doctors of chiropractic to become more proficient in their skills to work with this population.
Excellent. Yeah. Well, I wonder if you could tell us about the Florida Chiropractic Association Journal and talk about that a little bit.
Sure. Well, a lot of what we just talked about was in that regard. The touched upon what we've learned and where we're headed moving forward, but it outlined the key features of what it would take for a chiropractor to lead. One, and this is not any, whenever you're working with any specific population, it's no different. You need to know the population. Some chiropractors are very close to first responders or firefighters, and they understand the market. But one of the first thing you need to know your population. They're very unique. They see things that I will never see, and that most chiropractors will never see on a daily basis. Urgent emergencies, deaths, mortalities, morbidities across the board that we can only imagine. And when we get into conversations with the firefighters and chiefs, they get teary-eyed. And as a chiropractor, when a firefighter comes into your office, whatever the time of day is, say it's your first patient day or first few patients of the day, you need to be cognizant of where they might. If they're coming off shift, assume they've seen things and had to do things that you have not. You have not. And you need to manage this person a bit differently than the general population. So that's described. And then some of the wellness features on firefighter nutrition that need to be looked at. They eat poorly. They, when they're going out for an emergency, they don't know when they're coming back. So it's not like they can sit and prep a meal. And they, on shift, firefighters, group, the career firefighters, they cook their meals on shift. There's a firefighter who usually is delegated as the cook. And most of them get minimal funding for none of the jurisdictions that I've worked with pay for firefighters' food. They chip in, they go to the grocery store every shift. Interesting way to do it. They go to the grocery store every single shift. Anyway, you prep a meal. That's great. And a number of times, I can think of one in particular. You go there, whatever our purpose was for educational or recruitment, go there. Just get there around the table. I remember one in particular, they had a nice, like a Mediterranean salad, chicken, olive oil, the vegetables. Great, all there. Bell rings, they're gone. And they don't know when they're coming back. So the first thing they think, sugar, energy. Grab the donut, grab a candy bar, whatever. They need something walking out the door. So I'm sitting there with the captain that went with me, and I'm like, hey, what do they do with this food? He shrugs his shoulders and says, if they get back in 15 minutes, they'll eat it, otherwise it gets thrown out. So who knows what they've eaten in the meantime. So their eating environment's extremely poor. Chiropractors can have a big impact on proper nutrition around that. The direct impact on shift eating, as a chiropractor can impact that, but an overall nutrition program that can avoid those ups and downs chiropractors can lead. So we talk about that in this paper as well, and probably in a more brief method than I just did. And then what it takes to exercise. We talked about some of the implementation barriers and facilitators too. But then we allude to at the end that there needs to be some stronger training program or more focused training program for chiropractors, and that's where we are headed at the moment in collaboration with the FCA.
Yeah, that's terrific. I wonder, as we're starting to wrap up here, are there any other topic areas you'd like to chat about?
Yeah, we didn't mention the study that we did with the military.
Oh, yeah.
Spend a few minutes on that.
That was interesting because, I'll let you go because I don't want to steal the thunder from your own study. So go ahead.
Yeah, fine. So, first of all, chiropractic in the military, the potential impact that we can have is profound. There's been a number of studies that have come out recently on chiropractic in the military, including one very recently on veterans, the benefit of adding chiropractic to medical care versus medical care alone in veterans, which was a great study. This particular study we did that we completed 3 years ago with an active duty Army soldiers at Fort Sam Houston, Texas. And this was implementing high intensity progressive resistance exercise in soldiers who were training to become combat medics. Large study, almost 600 soldiers. We compared low-level core motor control exercises to higher-level lumbar progressive resisting exercises. And we found that training on lumbar extension strengthening results in superior strength gains than core exercise, and no difference in the core and motor control testing that we did between the groups. The interesting component of this was the training was only one time per week, and we noticed relatively large strength gains, 10%, in a population that you would think would already be fit. Given that soldiers, once they get out into combat, they're not going to have access or be able to exercise a lot. We were trying to figure out how to implement a low frequency exercise for them to be able to do. And we're hoping to be able to expand upon this work in the future with some of the other work we're doing in the military, including a new grant that we just got with a team of physical therapists and an MD on chronic low back pain management and veterans. So hopefully I'll be able to update you on that at some point.
Well, what do you think explains the reason why the military personnel didn't improve on the core endurance exercises, but previously you talked about the firefighters did make an improvement? What do you think explains that?
The military personnel started higher. They were more fit. So my firefighter colleagues don't like to hear that, but they started out quite a bit higher in their core endurance than the firefighters. So they had less room to grow. And the testing, the instruments, whether it's a Planck test or a Baron-Sorensen test, probably have ceiling effects. So
that's interesting. Do you think from the military, do you think many of them already engage in some sort of back extensor training?
Well, the Army Physical Fitness Battery does not include anything specific. So I don't know if at this time they didn't. I still don't think they do. But that's, they came in. These are people that came out of basic training. So we first thought that they might have had some fatigue, residual fatigue for all the training they did. But these are, they're relatively fit. So their baseline endurance scores were much higher.
Gotcha.
Than the firefighters. So.
Yeah, that was intriguing. Cool. So, Dr. Mayer, can you tell us about any training opportunities for chiropractors?
Yes, that's a good question. As I transition into the new positions as at a nonprofit research foundation, and with some private work on R&D, the opportunities for unique and innovative training of chiropractors, particularly those that have a research interest, will be there. We will have interprofessional relationships in very varied populations, particularly those with first responders, and it's one area that we will be developing or have developed and will be developing in the future. So any chiropractors, practitioners, or those that are interested in a research career, we have strong internship programs and educational programs that I would love to be able to build upon and work with the chiropractors across the country.
Terrific. Is there an email or some place where chiropractors can get a hold of your organization?
Yes, it's John Mayer, like my name, and like the singer's name, by the way. Spelled exactly the same. John Mayer. Yeah, I had the name first, actually, like I did. But anyway, John Mayer at USSF, so U and 3 S's, F.com. And that's the initials for U.S. Spine and Sport Foundation.
All right, terrific. Well, a goal of this podcast series is to motivate and assist practitioners and students alike to pursue research careers in chiropractic science. I ask this question of everyone, but I'm certainly interested to get your ideas here. Can you offer any advice to aspiring chiropractors who might wish to become scientists?
Yes, that's a great question. Be prepared for a rewarding career. Be prepared for sacrifice. Stay focused. Think beyond if there's going to be financial gains for you, which may or may not occur. Think while you're doing it and be very focused, and don't worry about what people around you are doing, because it will be rewarding. You'll have a much different type of base from which to help people, and there's a lot of value added, and I think this is one area I've discussed with a number of DC PhDs who are at my stage of career. Where's the next generation of DC PhDs coming from? Where are researchers coming from? We need you. Be focused, be persistent. It's not easy, as you know, Dr. Smith, managing, juggling all sorts of other things, but it is rewarding, and we need you into the future.
You couldn't agree more. We absolutely need more chiropractors interested in doing research, 100%. So, well, thank you, Dr. Mayer, for coming on the podcast. It was a pleasure speaking with you.
Well, thank you very much for inviting me, Dr. Smith. This was outstanding, and I wish you the best with this.
Thanks again for listening to the Chiropractic Science Podcast. In this interview, we talked with Dr. John Mayer and his work in exercise with firefighters and the military and the general population. We also discussed how chiropractors can implement these strategies into their practice. Until next time, have a great day.